Well, let's stay with that story. I'm now joined by PSA KZN's manager, Mlungisi Ndlovu, speaking to us live on some of the allegations certainly made by the family and what the Public Servants Association has found. Mr. Ndlovu, thank you so much for speaking to us. A good evening to you. You hear the family speaking of just the shock and how much this 25-year-old intern doctor has gone through. Talk to me about the involvement of the PSA, the amount of information that you have been able to gather, not just on what has happened to him, but the situation at this hospital.
Greetings to the viewers at home. Firstly, we send our condolences to the doctor of Dr. Mazwi family. It's a very sad day in our health systems because as PSA, we have been on record warning the department. We're there on the 16th of August talking about the bullyism in the workplace, toxic management. We're there on the 10th of February raising the same issues. Even when we want to end the memorandum, the Department of Health have taken a positions to regret not to take memorandum from PSA. This is a very sad story because if someone is sick, like this young intern, he reported that he's not well, and the supervisor should have just allowed this young intern to be able to rest. It took his family about 6 years to invest in him. He only started in January at the age of 25, collapsing and dying at work. We have warned them. We have warned the department. In actual fact, we send an email, a letter again to the MEC, and we're expecting the MEC to be able to visit this particular place. You know, it's not only this doctor that have passed on. We went today to meet with the medical intern. You know, it is survivor of the fittest. You know, you can see from their eyes that those kids are very scared. They are being ill-treated. They are being bulldozed. And the view of the PSA is that the Department of Health seem to be not care. Even when you see their media statement, they are really not zooming in what has happened in Prince Mshiyeni. Surprising, when we went to bid block with management, the CEO told us that the supervisor has now been removed to supervise the intern. But what we said, why are you still have this perpetrator on the crime scene? They should have removed this doctor to ensure that investigation is done. Why are they refusing the sick leave? So that's why we are saying the Minister of Health need to come on board. We have talked about Prince Mshiyeni for quite some times. Not only Prince Mshiyeni, you also have different doctors. If you look at their media statement, those doctors that are affected, they are very depressed because they challenge them, Prince Mshiyeni, they are overworked. As a result, they use intern as a medical doctors without proper supervision. Some of them, they're looking after patient without proper supervision. So if they called this consultant to guide them and supervise them, they are not taking calls, they are not with them, so they need now to learn on their own. That's why even the medical council must be able to come on board. So as PSA, we have also written before to the Public Protector and Human Rights Commission. They did nothing. When we requested investigation, when they were harassing about 28 nurses, they called an investigator who came there to cover up. The department doesn't really show that they care about the frontline workers. So who else that's supposed to die in that particular hospital? So there should be consequence. That is the rule of the PSA to say, we are defending them. We've got interns that are our members. They must be able to join, but you can't exploit these young doctors. Why are you exploiting them? It is for this reason when we said department must ensure that they address issues of shortage, they are not filling the position. It's very sad that even at this stage, we have not seen the report of the MEC, including the leadership of KZN to visit, because this is a crisis. We are saying everyone must call for justice. Everyone must call for justice if they really understand what we are facing in the province. The healthcare system is really is collapsing. So we need to be able to take actions. We've got many cases of doctors from Dr. Pislika Isaiah Seme, cases of doctors from Victoria Mxenge Hospital, from Eddington. People, they are being abused, and these doctors believe that they are not being respected. And the sad part, our own government can't treat these medical doctors in this manner. Even there are no tools to treat.
I want to broaden the conversation, Mr. Ndlovu, because here's what this is showing us. You have an intern doctor. I want to, us to really think about this. An intern doctor who is at a health facility needing treatment and dying. Immediately I think about, well, not just the treatment of staff, as of course you have highlighted, and that needing to be addressed, but also just the challenges within that very hospital and what they mean then for patients when doctors are going through so much strain. I specifically remember in February, reports of surgeries being postponed at that hospital, concerns about hygiene as the hospital in and of itself was facing water cuts. And perhaps you have an update on how it's coping with some of those challenges. But if this is the situation for a doctor, what does it look like for the patients?
You know, as PSA, we are saying, you really, we are not saying when it's your time, people will be able to stop. How can someone collapse and die in a facilities where he's supposed to get assistance? That's why we are saying everyone should be investigated in the process. What about the patients, So it is for this reason as PSA that it concerns us. It says Department of Health and that hospital and other healthcare facilities, they don't care about frontline workers. So it's easy them to take action, charge them, be able to dismiss them. The question must be asked, why they've refused to accept medical certificate. When PSA was there on the campaign to service members, we see this medical intern, even the way he was walking, you could see that he's walking with pain. So now the department have not even issued a media statement focusing on that particular areas, because when PSA raised these issues, people think we're making it. We have warned them. So now they must take full accountability. The leaders that we have appointed them to lead us must take full accountability. That hospital, this hospital, from time to time, we've got issues of waters, as we have mentioned, the issues of the ICU. Those 28 staff, they're still undergoing disciplinary hearing. How do you expect them to cope? They refuse to engage. But as PSA, we're not going to stop, because we are the voice of the voiceless. So we are now on the national media platform. The minister is watching. The president is watching. Is it not the time to make these changes? Because if the MEC cannot be able to act, you've got the premier in KwaZulu-Natal. If the premier can't act, you've got the minister. If the minister are not there, you've got the president who lead the executive.
Yeah.
This is what we see on daily basis. You call for investigation, you send memorandum, nothing has happened. But what I'm saying, we have even engaged the Deputy Minister, Honorable Jomo Spear, the Deputy Minister of Employment and Labour, to say, visit these interns. We have engaged Dr. Ndlovu is also engaging to say he will be able to go and visit those interns. They need assistance. We must make the right moves, because we believe that Nelson Mandela warned us that we must never allow a situation when we oppress one another. We must be able to deal with this particular system.
Yeah. Mr. Mlungisi Ndlovu there, the KZN Provincial Manager for the Public Service Association, speaking to us about that story coming out of the Prince Mshiyeni Hospital, where a 25-year-old intern doctor collapsed and died at the facility on Monday after requesting time off, saying that he is not well. In fact, being at a facility the day before, needing to get assistance, and yet was told that he must report to work. And then while on duty, he collapsed and subsequently lost his life.